Hey, Matt, thank you so much. If you are looking to either choose a Medicare plan for next year or change plans, you do have less than a week left because the deadline is Friday, December 7th. Sort of. I'll get to that. It can be a confusing process. So joining us to sift through it all, I'm happy to have back on the show YVES Solomon from WellCare Health Plans. Good to see you again,
good
sir.
to see you, Tim. How are you?
Good. Glad to have you back. First things first, why don't you just tell us a little bit about WellCare Health Plans?
Well, WellCare is a health company that's focused on government-sponsored managed care services. So our mission is to provide better, healthier lives for our members, and we do that by going beyond Medicare. So here in the state of Connecticut, we offer Part C, which is Medicare Advantage, and prescription drug coverage, which is Part D of Medicare.
Yeah, and talk a little bit more about that, just for people who aren't, they don't understand the Part C, Part D. They just see original Medicare and a Medicare Advantage.
Okay. So original Medicare, which is a federal health insurance program for people who are 65 and older, people 65 and under with certain disabilities, or anyone with end-stage renal disease, is basically comprised of 3 parts.
Yes.
So Part A covers your hospitalization, your skilled nursing, and your hospice. And generally, you get that automatically as long as you've worked and paid your Medicare taxes while working, right? Part B, which is the second part, covers your medically necessary services. So that's kind of like your doctor's visits, ER, urgent care, things of that nature. And for the Part B, there's a monthly premium, and you have to elect to pick it up.
Okay.
And finally, there's one more part, which is Part D, which is the prescription drug coverage, and that also carries a monthly premium.
That's always what I forget about the Part D.
Yeah.
Annual enrollment. Now, we said December 7th is sort of a cutoff date, but that's not entirely the whole story, right?
Yes, exactly. Okay. So there's a big change for next year. So first, the open enrollment period is typically October 15th to December 7th, okay? Yeah. And during that time period, seniors can make adjustments to their Medicare coverage. But now there's a change for next year, which will allow them to make one additional change between January 1st and March 31st. One change. So if for some reason they make a decision that they aren't happy with, from January 1st to March 31st, they can make one additional change to their coverage. And that's a new rule that's coming into effect for 2019.
So please keep that in mind. Now, as far as reviewing each year, why is that so important instead of just riding with what you have?
Well, it's super important because you want to make sure that you have a health plan that fits your healthcare needs as well as your current financial situation. So I'll give you an example. If you have someone who's relatively healthy, it may be better for them to go with one of the zero premium plans that are available, because with that they'll have minimum out of cost, expenditures as long as they're only seeing their doctor a couple of times a year.
Right.
You know what I mean? But a surprising statistic is 62% of the seniors do not review their Medicare coverage. 62%. Wow. And that's not really good, because the bottom line is you never want to be in a situation where you don't have the appropriate coverage when you need it the most. Nobody wants to be in that situation.
Yeah, it's not efficient. It's not good for your health. For people who want to learn more, maybe they're just, I got till the 7th. I need to get going with this. Where can they learn more just about Medicare in general and also about WellFleet?
Well, for Medicare Advantage, they can call 203-497-2800. And also, I just want to share, building on WellCare's mission to provide better and healthier lives for our members, we realize that there's sometimes obstacles and issues that keep them from accessing the health care. Yes. Okay? So because of that, we've set up a WellCare Community Assistance Line, and that number is 866-775-2192. So that's for people that need assistance and resources. And to be clear, that's open to anyone. That's not limited to WellCare. Anyone who needs help, you can call 866-775-2192 to get some assistance and access to resources.
And you can see the website also down there. We'll try to get those numbers up on fox61.com as well. Mr. Solomon, thank you so much for your time.
Absolutely.
Good
Thanks
to
for
see you
having
again,
me.
sir.
Sure.
A pleasure. Let's have you back every year.